What you should know before starting intrauterine insemination. Assisted reproduction techniques are known to help couples struggling with infertility issues. If you're considering fertility treatment, you might be wondering if IUI could help. We've collected the latest information on this conception method to help you make a better informed decision on your journey to parenthood. What is IUI treatment? Intrauterine insemination, IUI, is one of the least invasive fertility procedures and may be offered as an alternative to IVF, in vitro fertilization. Insemination is accomplished by injecting a large quantity of concentrated sperm closer to the fallopian tubes to facilitate conception. As the most common type of artificial insemination, IUI is recommended for less complex infertility issues like low sperm count, decreased sperm motility, unexplained infertility, mild endometriosis, hostile cervical mucus. Female couples can also benefit from IUI. The treatment, however, is not advised for women with blocked fallopian tubes, pelvic infection, or moderate to severe endometriosis. Fertility tests before IUI. Before starting treatment, you should consult a gynecologist or fertility specialist to order basic fertility tests. The infertility evaluation will attempt to establish the causes of infertility and influence a personalized treatment plan. Fertility tests for women. For female patients, the fertility investigation should include the assessment of ovarian reserve through anti-Mullerian hormone test, full hormone profile like follicle-stimulating hormone, luteinizing hormone, estradiol, and prolactin, ovulation test like luteal progesterone, and pelvic ultrasound. The doctor should also check the fallopian tubes for blockages. If the female patient has a history of pelvic infection, endometriosis, or pelvic surgery, the recommended assessment method is laparoscopy and a diet test. Fertility tests for men. Male patients should undergo semen analysis and hormone profile tests should the semen analysis come back abnormal. Fertility tests for both partners. In order to ensure the safety of IUI treatment, both patients require virology screening for HIV as well as hepatitis B and C. Routine pre-cycle testing also includes blood tests for rubella and chickenpox. Follow-up consultation. Once the fertility workup of both partners has been completed, couples should see their fertility specialist to discuss treatment details, the prognosis for success, and possible risks. At most clinics, a fertility nurse will go over the ways that stimulation drugs work and what happens during the IUI process day by day. The nurse should also provide contact information for the clinic during this cycle. How does IUI work? A typical IUI cycle begins on the first day of your period, which is day 1 of menstrual bleeding, and ends 2 weeks following insemination when a pregnancy test is carried out. The IUI cycle involves multiple steps including pre-cycle testing, medication period, insemination, and a 2-week wait post-procedure. The process is relatively short and takes about 90 minutes. Sperm collection for IUI. Sperm is obtained from either the male partner or a donor. If you are using sperm from your partner, a semen sample will be provided at a clinic on the day of insemination. If frozen donor sperm is being used, it will be thawed at a clinic's laboratory by slowly warming it up. Sperm is then processed using density gradient centrifugation or a swim-up method to separate motile sperm cells from other semen components. Unprocessed sperm should not be used, as there's a risk of severe allergic reaction or infection. Sperm preparation takes about 45 minutes. The process of insemination. After sperm is prepared, it will be injected into the patient's uterus using a thin, flexible, soft tube. At least 2 vials of pre-washed sperm will be used, and the entire process takes about 5 minutes.